Well, hi, everybody. I am Charlotta Carter, CEO and founder of Llena AI, which is a type 2 diabetes management platform. And you're here with us today on our podcast called Don't Eat Yourself to Death. And we have here Dr. Darrell Carmen, who's going to banter back and forth with us about diabetes and teach us something, even though he has patients that have diabetes, and he's going to share that experience as well too. And you're here with my co-host, Rinaldi Jacobs. And Rinaldi, take it away.
Well, glad to be back on our second Llena podcast with Dr. Carmen. And one of the things, Dr. Carmen, that we particularly try to focus on with Llena is the effects of diabetes on people of color and on everybody in general, but specifically how that affects people of color. In your position as a urologist, in our pre interviews and stuff, you were saying 25% of your patients have diabetes.
That's correct, and thanks for having me on today. As a urologist, I am not the gatekeeper, so to speak, for chronic management of diabetes or chronic illnesses. I'm a surgeon, and I deal with the urinary tract. However, my patient population, and I'm in the Atlanta area, my patient population has about 25% of them are diabetic. If you look at the national average, across the board, the typical population of diabetes is somewhere between 10-12% throughout the country. But there are certain segments geographically that you'll have higher risk of or more patients that have diabetes. So I happen to be one of those that I have a higher than normal percentage.
Do you find demographically there's a higher percentage of diabetics in the Black community than in the white communities or Asian communities?
The short answer is yes, and if you don't mind, I'm going to elaborate just a little bit. So my practice is in the South, Metro Atlanta, Georgia. If you look across the country, in the Southeast, for the most part, weight is, I'm bringing up, there can be somewhat more of a weight issue in the South in terms of being a little overweight. What happens there, when you look at adult onset diabetes, 85% of those patients have some degree of being overweight, so that puts them at risk. And I think that has a lot to do with my population in my practice. Also, probably 60 to 70% of my patients are either of African American descent or people of color. So yes, there are several reasons why this occurs.
And part of that, Char, in your journey, we know that your family and my family also have a history of diabetes, and the weight thing is all part of what Llena's trying to control. So, Charlotta, but you're not an overweight person, and you're a fairly fit person,
I
and
beg to differ.
diabetes can strike. I'm sorry.
I beg to differ, but thank you.
Well, I knew her back in the '80s, so you haven't grown that much. But some of us are rounding out, as you will, Dr. Carmen. But weight and diabetes go together. But if you could talk about a little bit, Shaw, about the connection between the genes, the inheritance of diabetes, and then Dr. Carmen, how much do you see the male patients and then their children or their sons or whatever? So, Shaw, a little bit about your history and connection with diabetes.
Yeah, definitely. I think we all grew up in the South where food is king, basically. And, in the Black community, we really know how to cook food. So we know how to eat food. But my family has a long history of diabetes. My grandmother died of it. Of course, my aunt did too. My mom has it. I have cousins and aunts. And so when I was diagnosed with it, it was a matter of when, not if. I did get it later in life, much later than the rest of my family, but it is very connected to heredity. And so I was expecting it, and I tried to balance it as much as possible, and that's why I came up with this solution with my endocrinologist, and we developed Llena based on eating nutritiously and exercise and coaching. So with the help with Llena and my endocrinologist, I was able to get off of insulin in about 6 months. So I'm really happy to be part of an ecosystem where we're trying to break the cycle. Our ultimate goal is to eradicate type 2 diabetes. I know that's a tall order, but we have to start somewhere. And so this is why we're on this journey together.
Dr. Carmen, so since all of your clients are males, and a large percentage of them are African American males, and whenever you get ready to talk to a urologist, people are like, okay, yeah, all right. so, but in all seriousness, though, with the hesitancy among African American males to get treatment of any kind, particularly anything dealing, with the genitalia, do you find that is a roadblock for people, even, not just with diabetes, but in general?
So there is somewhat of hesitancy in men in general and the African American community. And just to back up a little bit, most of my patients, probably 70%, are men, but I do see female patients. They can develop kidney stones. Female patients as well as male patients will have tumors such as tumors of the kidney, tumors of the bladder, urinary tract infections. So there are some female patients that I see. My practice specifically, though, I tend to focus more on men's health, to your point. Back to the hesitancy, and usually when I'm talking about diabetes, when I see the male patient that's diabetic, the thing that comes to mind, and I use this acronym, I call it 3 I's and a T. The T stands for testosterone, low testosterone. They're at risk for infections, urinary tract infections, urinary incontinence, and impotence or erectile dysfunction. So if you think about it, the issues that they're having, a lot of times it's an uncomfortable conversation with anyone. So it takes a little time to get them to warm up and actually start to feel comfortable sharing information about what's going on, so we can move forward with solutions and treatment options.
And as part of the diabetes, does it lead to some of those things that you just mentioned, erectile dysfunction and those things as well?
Yes.
As a consequence of diabetes,
yes, diabetes it's a systemic illness, so it affects all parts of the body. So in the urinary tract, you notice these things because it's affecting blood vessels and nerves to the penis, to the pelvis, etc. But and so that's why they'll suffer from problems with erections. The part with low testosterone, it decreased blood flow to the testicles, and therefore the testicles are not as robust, so to speak, over time. So they start having low testosterone, and again, it just becomes a cascade of events. They can also be immunocompromised, meaning putting them at risk for infections. So that's sort of the cascade of events that takes place over time. The thing that's very helpful, though, the diabetic that can control their sugars, their hemoglobin A1C, and that's typically the blood test that's being monitored by their primary care to gauge what's happening on an outpatient basis. But if you can keep those levels down, it's not per se inevitable that these things are going to happen, but poorly controlled diabetes, it will exacerbate those conditions.
Sure.
you just take this message on the road. I think more men need to know about this.
Well, hopefully our podcast will do that. I did not realize he had females in his practice. And Dr. Carmen, kidney disease, of course, is a part of diabetes. So if we could lead off with that.
So yes, I do treat female patients. As I mentioned earlier, they can, all patients, men and female, can suffer from problems with urinary tract infections, problems with urinary incontinence. They can have tumors in the urinary tract, such as kidney tumors, bladder tumors, etc. So I address those things in both men and women.
And I understand too that diabetes also affects the kidneys as well, because you see a lot of diabetic patients go into dialysis, and then you get chronic heart disease. Do you have a large percentage of patients that do develop kidney problems and kidney disease as well from diabetes as well?
So unfortunately, I do have a group of patients that suffer from renal insufficiency or kidney failure as well. And kidney failure, when you hear that term, it's not an all or none phenomenon. You can have kidney insufficiency and not go on to dialysis. Actually, most patients who have some degree of kidney failure, renal failure, they can live a normal life, not go on dialysis. They just have to manage their illnesses, such as diabetes, high blood pressure, hyperlipidemia, or high cholesterol. If they can manage those things, they don't necessarily have to go on to dialysis. So it's key to follow up with their primary care to make sure that they're compliant with their diet, their medications, and things of that sort. And usually it's not an all or none phenomenon. Is really what I was getting at.
And what I'm hearing from you, and what we hear from a number of physicians, is diet, exercise, and coaching can really help you manage a lot of these chronic diseases. They may not be able to cure them, but they definitely can help you manage them, and it can prolong or put off the effects of a lot of these chronic illnesses for quite a while.
Absolutely. I talk to more guys than females, so I tend to use analogies that guys will relate to more than females. So when I'm talking to a lot of patients, if you look at a car, if we have a car and we get 5-10 years out of a car, that was a great car. We're trying to get 70, 80, 90 years out of a body. So you have to take care of it. So essentially that's what we're talking about right now. So you don't have to go to a mechanic, you have to go to the doctor. And then there's some self-maintenance that you can do, which is what you just talked about in terms of your diet and exercise. That's something that no one can follow you around, force that discipline on you. It has to come from within. You mentioned coaching, and that is very helpful in terms of getting people and this, just like when you work out, it helps to have a partner or have someone else who has a vested interest in the process of you doing better, and the both of you doing better for that matter. So you're right. There are a lot of ways to come up with a long-term maintenance plan to help you succeed.
As part of Llena, one of the biggest things, Dr. Carmen, is, of course, we talk about, the name of this program is Don't Eat Yourself to Death, specifically dealing with urinary tracts and all those things. Are certain diets, I hate to say it, better than others? In other words, there's all these different diet plans out there, like South Beach, which some of them are very protein oriented. Then there's vegetables, and then there are, various other keto types of diets. Is there any one in particular you find is best for your patients, or is it a combination of both?
So when you're looking at diet in the diabetic patient, really it's sugars, obviously, insulin regulates your sugar. So diets that are high in sugar or high in starch for that matter. And that's something that a lot of people don't realize at the beginning, but starch such as bread and rice, once your body has broke that down into its elements or digested that food, so to speak, it's all a sugar at that point, and then it becomes hard to manage it. So diets that are high in starches, bread, rice, things of that sort. And again, that's a Southern diet. I'm in the South, so those things it can be problematic, and it makes it a little harder for patients to be compliant if they have grown up on that diet. And then now all of a sudden, as an adult, you're constantly trying to get them to modify that diet. So that can be a little problematic.
So
we all grew up in the South. We all grew up with great cooks, and it's really hard to break the cycle. So,
especially even in South Louisiana, of course, Charlotta, we talked about the variations of how Llena is going to be able to help people with different restaurants, because Dr. Carmen, as you know, people in the great state of Georgia cook a little bit different than we do here in Louisiana or Mississippi, even Florida. So, Charlotte, talk a little bit about how Llena is going to help people with if they go out to a restaurant. Thank goodness, hopefully, we'll be able to get out, Dr. Carmen, and get to restaurants and eat safely. But Charlotte, tell them how Llena can help people with not only their in-house diet, but when they go out to eat.
Sure. So basically, we have an artificial intelligence glycemic index technology. And what that means is we take in your biometrics, your blood sugar, blood pressure, your preferences, your location. And so we can recommend or give you a customized recommendation on what you should be eating, or give you a list of things that you can choose from that are within low, high, or medium glycemic values, as Dr. Carmen talked about. The glycemic index is the amount of sugar that you have in your food. So we really try to make sure that we give you some recommendations that are healthy with low and medium glycemic index. So you can cook it yourself. You can, take some of the recipes that we have. You can add your own recipes. You can order off the internet if you have Amazon Fresh. So we will recommend those to you based on your biometrics. Additionally, we also can map where you are via GPS. And if you want to eat at a restaurant, we'll give you a list of restaurants that are available in your area. That's also part of our network. And the menus that they give us, we can evaluate those menus the best we can. We're not in the kitchen cooking with them, so we don't know everything they're putting in there, but we can give you a great baseline of whether that menu item has a high, low, or medium glycemic value to it. So, and we give that to you in easy to read terms. So it's going to say red, yellow, green. So you'll know that if it's red, you probably shouldn't be eating this. Medium, based on what your based on what your blood sugar is saying, you have that choice to make. And I would say just, for most part, stick with all the green, the green suggestions. But we give you that functionality to either cook for yourself, or if you want to go to a restaurant or order out, or as soon as food trucks are available, we're connecting back with food trucks as well too. So we're trying to help you manage your entire ecosystem 24/7 to help you make those better choices. Dr. Carmen, again, thanks for joining us. I know you're super busy, and we've learned so much from you today regarding diabetes and urology and how that all comes together, both male and female.
Thank you all for having me on the program today. This is a great platform for education, because really this is what's needed in healthcare is education. We all agree we're lifelong learners, so I think that's important, and that's really where I would like to focus on. I tell my patients, and I tell family and friends for that matter, you want to take control of your own destiny. You want to try to plug into a primary care physician, a gatekeeper early in life. Typically, that should be somewhere in your 30s some of the illnesses that are most common in our communities: high blood pressure, diabetes, cholesterol. Some of those things are they're silent diseases, so you won't really get any signs or symptoms unless you're being seen by a physician to screen. And I use the example of the diabetic sometimes that will be on their way to work, or someone who's not diagnosed with diabetes, I'm sorry, but has a high sugar. Well, that person may get lightheaded, pass out in their car. High sugar, undiagnosed diabetic. So they end up in the emergency room, and that's when they realize that's their first encounter or first diagnosis of diabetes. So sometimes you can head that off by starting with a primary care that will draw some baseline blood work and start heading off these things early in life.
How important is it when we go to those doctor interviews to tell, some people are like, I don't want the doctor to know my family business. But how important is that part of it, Dr. Carmen, that you tell your primary care physician? Because, Charlotta and I were talking during the break, and my primary care physician, who's been my physician for 17, 18 years now, he caught my heart issues. You know what I'm saying? And if it wouldn't have been for him, I may not be doing this interview. So how is it because my family has a history of both diabetes and heart disease. My father had open heart surgery, both of my older brothers and one of my nephews. So I have two sons that said, guys, you're in your 30s now. You need to start getting your annual physical. But how important is it to tell the doctors about the family history, as Charlotta has laid out, of diabetes and these different ailments?
So it's very important. Healthcare is not a pure science, it's an art. When we hear about genetics and family history, things of that sort, it's not always very clear what happens. It may be a female that has a heart disease in your family, and then the next person, it may be 3 or 4 men or male family members that have heart disease. But so it's not always cut and dry. So just giving the doctor that provider some direction, what to focus on early in the process versus later. I'm going to switch to something totally different, but it drives this point home: prostate cancer. So prostate cancer is actually it's a cancer of men over 40. But actually, the youngest person to die that I'm aware of that was diagnosed and died of prostate cancer was 28. Wow. So no one would think about that unless someone told you, I have a strong family history of cancer in my family. Okay, that doctor now has a red flag. I should approach this a little differently than the average person. So I just use that example to illustrate what we're talking about here. Family history is very important.
Okay, I agree. That's always a lead in, especially for people of color, because we definitely need to go back and find out, what's in our bloodline.
And the elders didn't always tell us everything because, to a large extent, Charlotta, they didn't know, and they didn't go to healthcare accessibility. Dr. Carmen, is also equally as important for people to get the proper diagnosis for whatever it is that you have. And part of what Llena seeks to do, and we're going to wrap up. Part of what Llena seeks to do is to get diabetes education to the masses in an easy, I'm going to just say it this way, easy digestible way, no pun intended. But Dr. Carmen, we appreciate so very much your coming on to the Don't Eat Yourself to Death podcast. And we know that we'll have you on again. And thank you so much. And for those of us who have health challenges, it's good to know that there are professionals out there that focus, on us and our issues.
Thank you.
Thanks again for having me on.
Sure. And that's going to do it for this edition of Don't Eat Yourself to Death. I'm Rinaldi Jacobs with Charlotta Carter, and we've had as our special guest Dr. Darrell Carmen, urologist in Atlanta, Georgia. Thanks.
Thanks for joining us today. Don't forget, check us out on social media and subscribe to us.